Okay, so Danny, is testosterone harmful long term?
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Okay, so this is a question we get a lot. Guys that are considering getting on testosterone replacement therapy are wondering what the long-term effects are. And guys that are already on testosterone are wondering if they are causing themselves more harm than good, because there's no real study out there that says, we have this, group of 50,000 guys that have been on testosterone replacement therapy for 50 years, and here was the outcome. Okay. The first thing you got to keep in mind is men have testosterone in their bodies their entire lives, right? We have that in our bodies' entire lives. The testosterone that we make naturally is identical to the testosterone we take exogenously, be it through a cream, be it through an injection, be it through a troche, a nasal spray, whatever the method is. When you are adding testosterone to the body does not differentiate between the two. It is the same. So for those of you who are saying to yourselves, well, I know that testosterone I make naturally is safe, but I wonder if that synthetic stuff that I inject, maybe that's dangerous. No. The body cannot tell the difference between the two. The molecule is exactly the same, and it treats it exactly the same. So, all this fear about the long-term effects. Have you ever popped an Advil, or taken a vaccine, or taken NyQuil, or taken statins, or taken blood pressure medication, or heart medication, or whatever else, any type of drug? Not even just that. Even just the stuff that you use in your day-to-day life. Maybe your toothpaste, maybe your Axe body wash that you slather all over yourself. Do you ever, while you're applying this stuff, say to yourself, I wonder what the long-term effects are of me using the soap on my body? No, you just kind of do it. When you go to a doctor and he prescribes you a statin to control your cholesterol, which is the stupidest thing ever, or blood pressure medication, or all this other stuff, you just take it, right? You just take it and you go about your day and you don't think about it. Vaccines are the same thing. You just go and you get your vaccines and you don't even think about it. No one ever seems to question the long-term effects. But when you're going to take something that's going to help to improve your health, when it's testosterone specifically, with all the stigma around testosterone, suddenly everyone is wondering, well, what are the long-term effects? I heard testosterone is dangerous, and I heard it can cause this, and it can cause all these issues. And, am I going to regret this later on? Let's look at why we are taking testosterone. If your testosterone levels are completely tanked, you're not going to be healthy. Can we at least establish that? You will not be healthy. If your androgen levels are in the toilet and you're a man, you will not be healthy. So you add testosterone, what happens? First of all, you're going to reduce your risk of stroke significantly. You're going to reduce your risk of coronary artery disease significantly. You're going to reduce your risk of heart attack, because testosterone is cardioprotective. You have a much less chance of ever experiencing any form of depression because you're going to feel good. Okay, you're going to reduce your risk of diabetes or developing it later on. You'll reduce your risk of prostate cancer. You'll reduce your risk of autoimmune disease, Alzheimer's disease. I don't know if I even mentioned that before. These are a bunch of things already right off the bat you will reduce your risk of having. Okay. Not only that, you're not even just reducing risk of things, you're also going to be taking advantage of benefits today. Okay, you're going to have improved sexual function, a better libido, better erection strength. You'll gain some muscle mass. We all know that having increased muscle mass will provide a better quality of life down the road. If you're a guy that doesn't have much muscle mass in their 40s, by the time you get to your 70s or 80s, you're going to be very weak and you're going to wind up with a lot of these issues. Having increased muscle mass is one of the best ways to have a better quality of life, because the more you have now, the more you'll have later on in life. Okay. Chances are you're going to lose some body fat, because even just going from a deficiency of testosterone to bring it up, you will lose body fat. And just that loss of body fat itself has a slew of health benefits. You're going to have better bone mineral density. So you're going to be much less prone to any type of breaks. These people, they fall, they break a hip, they break a leg, and they're in the hospital for like, this isn't something that will happen typically to a guy on TRT. Their bones are going to be stronger, especially due to the increased levels of estradiol that help with bone mineral density. You'll have improved cognition, so you have better brain function, clarity of thought. You'll have better cardiovascular health generally, overall. You'll have more motivation, you'll have more drive, you'll have more energy. So I want you to think about all of the benefits I just listed. I can list a ton more, but I have those benefits right now on testosterone replacement therapy that I did not have when I had a deficiency, right? I'm reaping those benefits now, and I'm preventing the risks of all the things I mentioned earlier now.
Before we continue, if you appreciate the content we bring to this channel, check out the Amazon links in the description of this video. These are the links to the products we use, going from supplements, protein powder, pre, post, intra-workout, anti-aging cream, sunscreen, needles and syringes to inject, and so on. If you'd like to purchase one of those products, please use the direct link so that it will earn us a few cents as a tip, and you'll be guided directly to the products we recommend. Thanks in advance.
All links should work on the US, Canadian and UK Amazon stores.
That's occurring today. It's occurring tomorrow. It's occurring next week, next month, next year, 5 years, 10 years, 20 years, 30 years. So let's say right now I'm 46. So let's say I continue doing this for a 30-year period. I'm now 76. How different would my health be compared to the Danny Bossa with tanked androgen levels, who did not benefit from any of these things and actually had a greater risk of all those risks I mentioned earlier occurring? Let's put them now side by side. Which of the two do you think I would prefer to be? Which of the two do you think has a better chance of being healthy? Which of the two do you think has a better chance of living another 10, 15, 20, 25 years? Probably the one that had all these benefits, and probably the one that reduced the risk for all these things. Okay, so everyone's wondering about the long-term safety profile, long-term. Testosterone and estradiol have been studied for over 80 years. Do you have any idea how many studies there are when it comes to testosterone and estradiol? I can send you studies that'll give you provide you a lifetime worth of reading. Okay, this stuff has been studied forever. Most of the things that you take on a day-to-day basis do not have studies dating back that far. They don't. Okay, the vaccines that you're taking today for HPV and this and all this, they don't have 80 years worth of study. Why are you taking this stuff and not thinking about long-term effects? Do they have 80 years worth of study for this brand of soap that I slather all over my? Is there 80 years of study of what effect it's going to have? No. Why is it that testosterone gets all the stigma and all the attention, but all this other crap that you take on a day-to-day basis, you just don't even think about it. You just take it. You just take it like everyone else. But testosterone, now we have to worry. Testosterone is going to provide you with these benefits today, and is going to prevent you from having these risks later on. So I don't get it. If you're wondering about, I'm just going to bring up the little notes I've got over here. Those of you saying, oh, it causes heart attacks, it causes stroke, it causes all this type of stuff. It is absolute, utter nonsense. There are a ton of associative studies out there that anybody with even a level 101 knowledge of TRT can look at the study and can see what's wrong with it. You can't just say, well, this is this, or this is that, so this was associated with that. There's no link really that you can link them together, because in every single study where they actually said, we took a group of men, we raised their levels of testosterone, and what happened? What was the outcome by doing this? And the outcome is always fine. They have studies of taking 600 milligrams a week for 20 weeks, which is a massive dose for most men. And 20 weeks later, they checked and said, no harm. So what's with all the fear? Why not just get a nice, healthy level of androgens, be healthy, reap the benefits today, eliminate, or not eliminate, but at least significantly reduce the risks of everything else, and just stop worrying about the damn thing, okay? Because if there is any type of issue that would happen, it's not something that's just going to happen overnight. This might be something that will happen over time, and you can see, hey, there's this and this happening, so let me make a little adjustment and take care of it, all right? There is so much research online that you can find, studies. One in particular, Abraham Morgentaler, did one called Testosterone Therapy and Cardiovascular Risk Advances and Controversies. It's got 213 references. Okay, so this guy has done his research. A huge paper that goes through every single element of all of the factors that are involved with TRT. And if you want to skip down to the conclusion, I'm going to read you this one paragraph. He says, review of the literature clearly reveals a strong relationship between higher serum T concentrations, endogenous or via T therapy, as beneficial for reduction of cardiovascular disease and cardiovascular risk factors. Okay? Higher levels of testosterone improve the risk of cardiovascular disease, cardiovascular risk factors. Public health may be harmed not only by inadequate appreciation of an actual risk, but also by the failure to offer beneficial treatment for a medical condition because of false claims or risk concerns. What's he saying there? He's saying that the doctors that are avoiding prescribing testosterone replacement therapy to men with deficient androgens are actually causing public health issues. Because if these men had their levels brought up to something healthy where they had a symptom resolution, they'd be much healthier. We would improve the health of men basically worldwide. On the basis of the current state of evidence, placing restrictions on the appropriate use of T therapy for T deficient men is likely to result in compromise of public health and a substantially increased future financial burden on the US healthcare system. Okay, this was an American study. Basically saying, if you leave these men with tanked androgen levels, the types of issues they will develop later on will put a burden on the health system, because now they're going to have all these, potentially a lot of these risk factors that I talked about, cardiovascular disease, heart attack, stroke, diabetes. Like these are expensive things for the health system to take care of. Why not nip it in the bud early on and help to prevent these from occurring at all? On the contrary, the weight of evidence accumulated by researchers around the world over several decades clearly indicates that higher levels of T are associated with an amelioration of cardiovascular risk factors and reduced risk of mortality. Okay? If you have healthy levels of androgens, you will typically be healthier, you will typically lead a longer life. There is no evidence of testosterone causing harm. Stop worrying about it. Get yourself healthy today. Eat well. Reduce your stress, try to sleep better, get your hormone profile done, exercise, and reap the benefits that most people will not be doing. And I can promise you, just by looking around, most of them are not. And then in 20 or 30 years, you can then look back, look around and see everything that's going on around you. And you'll probably be thanking yourself that you've been doing this for all this time compared to all the ones that didn't. So I hope that clears up that little myth.
I think the problem is that most people are not informed about all the benefits and are misinformed about prostate, heart issues, hematocrit, and so on. So I hope with this video that clears things up.
Yeah, I'm doing all this to prevent this stuff from happening. I don't want to wait till I start to develop issues and then let me see if I can fix it. How about put something in place that'll prevent me from having those issues in the first place? You know, it's called, you don't want to follow that sick care model where I only go to the doctor when I'm sick and they give me something to treat it. Do something to prevent yourself from getting sick to begin with, and you'll be a hell of a lot better off long term.
Okay, thanks Danny. Hey, thanks for watching. And now click on one of these thumbnails to learn a ton more about TRT and hormone optimization.